Bismillahirrahmanirrahim. Hello everybody. As we completed the op section, now we will have to continue start the gynae section. So this is the case number 1 in the gynae section, which state that a 13-year-old girl is brought to the office due to lower abdominal pain for the past 4 days. The patient has rectal pain with bowel movements, but no melena or frank blood. She has had this pain several times over the past year, but it usually resolves after 2 to 3 days. She has no fever, chill, nausea, vomiting, loss of appetite, dysuria, hematuria, or abnormal vaginal discharge. The patient has no chronic medical condition on prior surgeries. She has not reached menarche and has never been sexually active. Temperature is 36, blood pressure is 110/70, and BMI is 24 kg. Physical examination show a non-distended abdomen without rebound or guarding. There is lower abdominal tenderness to deep palpation in the midline. The external genitalia are tenar stage 3. On pelvic examination, a smooth, firm mass is protruding between the labia majora. Which of the following is the most likely diagnosis? Cervical leiomyoma, choriocarcinoma, complete Mullerian agenesis, foreign body, imperforated hymen, pelvic organ prolapses, sarcoma batroioides. So first of all, this patient is 13-year-old girl having lower abdominal pain, and the patient having rectal pain with bowel movements. Patient not reach menarche yet. On examination, there is lower abdominal tenderness to deep palpation in the midline, and there is a smooth, firm mass protruding between the labia majora. So diagnosis of this question is imperforated hymen. And here the correct option is choice E. Why the choice E is the correct one? Because an imperforated hymen is a common cause of primary amenorrhea. The hymen failed to penetrate during embryonic development. Patients with imperforated hymen typically present with cyclic lower abdominal pain in the absence of apparent vaginal bleeding. When menstruation occurs, blood collects in the vagina behind the hymenal membrane, that is hematocolps. The enlarging blood collection with each menstrual period causes increasing pressure on the surrounding pelvic organ, resulting in lower back pain, pelvic pressure, or defecatory rectal pain. Pelvic examination typically reveals a blue bulging vaginal mass or membrane that swells with increased intra-abdominal pressure, for example, Valsalva maneuver. Treatment is with incision of the hymen and drainage of the hematocolps. Now come to the incorrect one. Choice A, cervical leiomyoma. Uterine leiomyoma may present with bulge symptom, for example, rectal pain or pressure. There is a protruding cervical rather than vaginal mass. Leiomyomata are associated with heavy vaginal rather than amenorrhea. Choice B, choriocarcinoma. So choriocarcinoma typically present with vaginal bleeding, markedly elevated beta HCG level, and an enlarged uterus. The vagina is a common site of metastasis, present as a febrile mass. Choice C, complete Mullerian agenesis. So complete Mullerian agenesis may present with amenorrhea and a blind vaginal pouch due to the congenital absence of uterus and cervix. Choice D, foreign body. So a foreign body in the vagina typically present with abdominal pain, foul-smelling vaginal discharge, and vaginal bleeding. Choice F, pelvic organ prolapses. So pelvic organ prolapse may present with pelvic pressure and a vaginal bulge that increase with Valsalva maneuver. Pelvic organ prolapse is more typically in postmenopausal patient and is not associated with primary amenorrhea. Choice G, sarcoma batroioides. So sarcoma batroioides is a form of rhabdomyosarcoma, typically present during infancy as a polypoid or grape-like mass protruding from the vagina with associated vaginal discharge and bleeding. So the diagnosis of this question is imperforated hymen. Thank you.